everyone, Dr. Unati here. Today I want us to talk about something very sensitive, and it's something I observe across board, patriarchy. But this time I'm going to talk about patriarchy affecting healthcare. As a woman, as a physician or as a black physician, I see this every day in my practice. I'm going to give you an example here. We do see women from Africa coming for healthcare like any other woman, and the decision making in terms of how many children they will have, or they are interested to have, or they wish to have, and what their spouses wish to have. You know, all that dynamic of families, which is amazing. But here's the thing. Today I want to talk to my colleagues who are of another race, I'm black obviously, on how to communicate in a way that would not tarnish or offend these families when they come to you. Why I'm saying that? We have women sometimes would have maybe uterine fibroid. How you communicate these results to a black woman is very important. Why do I say so? In Africa, for many years, it's existing even today, women are seen as child bearers. And if they can't do so, they are seen as less of a woman. A lot of cultures are like that. A lot of traditions, which is sad because you have no control over your ovulation, your ability to have children, or your ability to carry these children, because it's a process. You know, carrying a child is not only carrying, it's also about the physiology behind it, the embryogenesis. It takes more. And actually, sometimes the problem could be the man himself. And in Africa, women have no opportunity to explore men's deficiencies in terms of what if it's a man's problem not to conceive? What if a man has low sperm count? So there's many things, there's a lot of dynamic around there, but unfortunately it has worked for men and against women. Women, when they are unable to conceive, they are seen as, they are given all sorts of names, shamefully. They are shamed, they are bashed by their in-laws, by their families. So is a woman who chooses not to get married. It's seen as a taboo when a woman chooses not to. There's so much happening in Africa. So what I'm here to tell, or probably to advise my colleagues from another culture or from another race, when a black woman comes to you, to your practice, and probably has an ectopic pregnancy or uterine fibroid that could affect her fertility in future, how you convey that result to her when she's accompanied by her spouse specifically is very important. I would like to see cultural diversity in our CMEs, how we communicate, not only even about black culture communicated to other races like the healthcare providers. I would like to know more about how East Indian would like me to communicate to him so that he or she understands me in a way that I don't offend her or him. I would like to know, how does a Caucasian wants me to communicate the results? How does a woman from Pakistan, like Arabic background, because it matters. Communication is fundamental. I've had recently a patient who was offended by the fact that the results were conveyed to her next to her husband, who thought she could never have children in the future. And the doctor did not mean negativity in any way, but it's how those results were communicated to her. This poor lady immediately thought, one, I'm going to lose my marriage. Two, I'm going to be named or bashed and be humiliated by my in-laws. It happens in Africa. So I want to hear specifically African men here, what are your thoughts? What can we do to improve the patriarchal systems in our continent? How can we improve healthcare so that women could have a voice of their own and also could not feel recessive in the society when they are unable to bear kids. I would like to hear your thoughts on this one.